we move on to the next topic, complementary feeding. The objectives of this topic will include the definition of complementary feeding, the nutrient requirements to bridge the gap in the complementary feeding, the types of food used, what not to feed, what are allergenic foods, and what to feed during illness, what are the myths and misconceptions related to complementary feeding. Now, complementary feeding is defined as introduction of appropriate semi-solid food when breast milk is no longer sufficient to meet the nutritional requirements of infants and therefore need to be given along with breast milk. WHO is defined as the introduction of complementary feeds to be started at 180 days of life or at completion of 6 months. The reason to decide upon this period is the infant has achieved head control and hand to mouth coordination is seen as part of the developmental milestones, initiation of biting movements, there is decreasing tongue thrust as a result, infant learns to swallow, and maturation of gastrointestinal and renal system to handle the newly introduced food variety. Now the nutrient requirements is required to be started mainly to bridge the energy gap. The breast milk is good enough and sufficient until 5 months of age, and as you notice in the graph, there is an energy gap of 200 kilocalories at 6 to 8 months, 300 kilocalories at 9 to 11 months, 550 kilocalories at 12 to 23 months, which represents a deficit of 33%, 45%, and 61% of the total energy needs required. In addition, there should be a good amount of micronutrient supplementation and iron, zinc, vitamin B6 should constitute at least 80% of the required nutrient intake across all age intervals. Whereas vitamin A, folate, vitamin C, copper, and iodine should constitute at least 30% of the required nutritional intake. In addition, essential fatty acid should be obtained from fish, egg, liver, vegetable oils, and the nut paste. Now, 7 food groups need to be introduced to the infant, among which at least 4 food groups need to be introduced. So, among them, the most commonly used in major proportion is the grains or the cereals, roots and tubers, which constitutes rice, wheat, maize, jowar, ragi, potato and sweet potato. Legumes and nuts constitutes pulses, nuts, oil seeds and dry fruits. Vitamin A rich fruits and vegetables constitutes the green and yellow and orange colored vegetables of fruits. The other fruits and vegetables which are locally available, seasonal and inexpensive ones. The dairy products includes milk, curd, paneer and butter. Eggs and the flesh foods include meat, poultry, fish and organ meats. Now, this depicts the balanced food which an infant need to receive in the form of a pyramid. The major proportion should be the cereals as well as the pulses and the legumes. The next in proportion would be the vegetables and the fruits. The lesser in amount should be the milk and milk products and the meat, fish and eggs. And the least in amount should be the fat, oil, sugar and the salt content. What are the attributes of food for complementary feeding? It should be locally available, culturally acceptable, and affordable by the family, which should be simple and less time consuming method to prepare the foods with the required items, which should simultaneously provide nutritive value for the food as per the requirements and easily digestible and palatable. Now, keep all these parameters in place. We need to introduce a single food. For example, it could be a fruit or a cereal which can be given at a given point of time and to be given for at least 3 to 4 days or at least a week, and look for any identification of the allergies for this particular type of food, and then move on to introducing the new food. Here, the parents have a major role in establishing good dietary habits, and they should be persistent in introducing a new flavor or a new different texture or a new combination of the food should be provided at least 8 to 10 times before deciding upon to discontinue that particular type of food. Now, what is the frequency of the feeding that has to be given varies at different age intervals. At 6 to 8 months, we need to begin with mashed food or thick porridges to be given at least 2 to 3 tablespoons in the beginning for 2 to 3 times in a day along with the breastfeeding, and increase the amount to at least 125 ml. Around 9 to 12, 11 months, mashed foods with finely chopped vegetables can be given. 3 meals with 1 to 2 snacks. These snacks should be similar like a finger foods where the child can hold it in the finger and eat by themselves. So which can begin around 9 months of age. Particular example would be the fruits or apple piece or a banana which can be given into their hand and they can snack upon it. And in addition, they should be allowed to continue the breastfeeding. The quantity which an infant should take should be approximately around 125 ml to begin with and can increase up to 250 ml. Around 1 to 2 years, the infant should be able to take the family foods or the family pot diet along with chopped foods, which is particularly the vegetables which will be soft and where the infant is able to chew them and as well as pick with the fingers and eat by themselves, and given at a frequency of 3 to 4 meals with 1 to 2 snacks, and the volume to begin with could be 250 ml and which can increase to another 100 ml, that is approximating to around 350 ml. Now this is an example to tell us what is the consistency of the semi-solid food. Dripping down is a thin consistency where there is increase in the volume and there is decrease in the energy density, whereas the right consistency is in such a way that the food is held in the spoon and it can be given very comfortably to the infant. This is an example of the cereal pulse combination kheer, which is the best combination providing all the essential proteins. There's a new concept called baby-led weaning. This promotes the infant to self-feed from 6 months of age, utilizing the hand-to-mouth coordination skills, wherein they can manipulate the movement of the food in the mouth and get exposed to different textures and flavors, and thus gives the autonomy for the infant to decide what the infant wants to take, how long the infant wants to take, and when they would like to take the food. Thus, reduces infant food fussiness and increases the satiety. And another new concept is responsive feeding, which is on the basis of the psychosocial care by the parents or the caregivers, wherein there is active interaction between the caregiver and infants during feeds, during which the caregivers are continuously conversing with the infant or telling some stories and simultaneously feeding the baby and keeping the baby engaged during the feeding. Thus, it enhances dietary intake and also fosters positive behavioral development. And 6 months onwards is an age wherein there are likely chances of undernutrition or obesity depending on the feeding practices, which can be avoided by adopting these new methods of baby led feeding and the responsive feeding. What are the precautions that we need to take while preparing the food? First and foremost, we need to do a proper hand washing with soap before the preparation and while feeding the infant. The foods which is prepared should be safely stored away from the contaminated areas and served fresh soon after preparation as much as possible. If not, should be utilized within 2 hours of preparation. The clean utensils should be used and as far as possible to avoid bottle feeding to prevent any health hazards in terms of diarrhea, dehydration, and malnutrition. And the food should be fresh and equally smells good. The flavor is very important, and being palatable is equally important for an infant to accept the food. And also make sure there is no contamination of the drinking water which is being provided to the infant. Now, to meet the nutrient needs to bridge the energy gap, we need to provide a energy dense food. The reason to provide energy dense food is the infant has got a small capacity, but the energy gaps keeps widening as the age progresses. Hence, we need to give a low volume food as well as simultaneously increase the calories. So, which we can build up by addition of the ghee, vegetable oils, butter, and to a extent sugar and jaggery to be given in a minimal extent. Also, combine cereal and protein content in a food so that there is delivery of all the essential amino acids which is required for an infant will be provided. Now, with the process of malting, wherein there is germination of the whole grain and the germinated cereal pulse is dried, grinded, and this ready infant food is being used to prepare a freshly prepared food, and this malting reduces the viscosity of the food and simultaneously increases the energy density and helps in easy digestibility as well. And further providing thicker in consistency and smooth textures will reduce the volume as well as increase the energy density of the food that is being provided at each of the intervals. Now, what not to feed is equally important. So, we need to inform the parents that as far as possible avoid artificial, packaged, commercial, ultra processed, refined products like biscuits, which is being mixed in the hot milk and provided by the infants, which has got excess of salt, sugar, trans fatty acids, for example, which has to be avoided. And even with home prepared foods or beverages, we need to counsel the parents to avoid adding excess of sugar or salt. Preferably, no salt would be better, or it should be a minimal sugar or salt which has to be added. The reason being, we need to avoid the possibility of the risk of obesity or hypertension in later life. And we need to tell them to avoid sugary drinks or juice, rather give the whole food instead of packaged fruit juices or juices in general which is prepared at home. Now, what to feed during illness? The principle is to provide more fluids, hence increase the frequency of breastfeeding, which is invariably done by most of the infants. And in addition, other fluids need to be offered on demand, which could be ORS, which could be uh, dal water, or it could be a rice gruel, or it could be a buttermilk with a pinch of salt into it. So these fluids has to be given on demand. And in addition, always encourage the infants to take their favorite foods which is soft in texture, so that that helps them to recover from the illness as early as possible. And once they recover from the illness, we need to promote the feeding and replenish the deficient intake by giving an extra meal, and thus help in the catch up of the growth. Now, an important aspect while introduction of the semi-solid foods is we need to keep in mind about the allergenic foods, which can trigger and increase the possibility of atopic conditions in the form of skin atopy or allergic rhinitis or asthma. So the allergenic foods are cow's milk, any of the protein content, which could be in cow's milk, egg, fish, gluten, peanut, and seeds. Now, to overcome this allergic susceptibility, we need to develop an immune tolerance to these allergenic foods, which can be developed by early introduction and repeated exposure of these food proteins in small quantities during a critical window period. So, introduce the cereals at 5.5 months and peanuts between 4 to 6 months of age, fish around 9 months, and egg around 11 months of age. Helps to overcome the risk of atopic conditions. Now, we also need to emphasize on the myths and misconceptions related to nutritious foods. Most of the parents feel the locally available cheap seasonal fruits are not good, whereas the imported fruits from other countries, which is stored or preserved in cold storage, which are costlier, are supposed to have superior health benefits, which is not true. And considering fruit juices as more nutritious than the wholesome fruit. So we need to re-emphasize that wholesome fruit is better than the fruit juices, even though they wouldn't have added the sugar content. The reason being, wholesome fruit will have the fiber content which is devoid in the fruit juices, and which is very essential for the infant. And particularly during travels or long journeys, most of the parents prefer tinned or preserved juices, which they feel could be the best alternative to the home prepared food, but these contain chemicals and preservatives, and which is very harmful for the infants, need to be emphasized. And certain health drinks or protein powders with some exaggerated claims, like they are more nutritious, more enriched with vitamins, minerals, and micronutrients than the natural foods, should be discouraged. And any products which is promoted by celebrities, most of them think it is good, but which is actually, it is all a promotional activity which is being done, which is actually more harmful for the infants. So this biased, unscientific, misguided advertisements are misled and also neglected even by highly educated individuals, which has to be re-emphasized irrespective of their educational status. And also, most of the parents think these are the magic foods, those with the ultra processed, costly, and the cold storage ones, which should be highly discouraged among the parents. Thank you.